Hello, and welcome to my presentation on childhood obesity. My name is Amanda Howard, and I am a baccalaureate nursing student with Indiana State University. This presentation is part of a health education program project for Indiana State University School of Nursing intended to help educate people on childhood obesity and the lifelong effects it can have. After this presentation, you should be able to define childhood obesity, identify the risk factors of childhood obesity, identify the health concerns related to childhood obesity, identify prevention strategies for childhood obesity, and identify the diagnosis of childhood obesity, and identify the treatment of childhood obesity. Please take this time to pause the presentation and test your knowledge of childhood obesity with the provided 10-question pretest. Childhood obesity is a serious medical condition that affects children and adolescents who are above the normal weight for their height and age. Childhood obesity can turn into adult obesity if it is not addressed properly. Obesity can also lead to poor self-esteem and depression. If you have concerns about your child's weight, please schedule an appointment with his or her pediatrician to discuss your concerns. Risk factors for childhood obesity include diet. Regularly eating high-calorie foods such as fast foods, baked goods, and vending machine snacks can cause your child to gain weight. Lack of exercise. Children who don't exercise regularly are more likely to gain weight because they don't burn as many calories. Family factors. If a child comes from a family of overweight people, he or she may be more likely to put on weight. Physiological factors. Personal, parental, and family stress can increase a child's risk of obesity. Socioeconomic factors. People in some communities have limited resources and limited access to supermarkets. As a result, they might buy convenience foods that don't spoil as quickly, such as frozen meals, crackers, and cookies. There are many health concerns related to childhood obesity. Immediate health concerns include high blood pressure, high cholesterol, type 2 diabetes, asthma, sleep apnea, fatty liver disease, and heartburn. Future health concerns that can arise if the obesity is not addressed include obesity in adulthood, heart disease, cancer, adult type 2 diabetes, and other increased disease risk factors. To help prevent childhood obesity, limit your child's consumption of sugar-sweetened beverages and snacks. Provide ample fruits and vegetables, and eat meals as a family as often as possible. Limit eating out, especially at fast food restaurants. Adjust portion sizes appropriately for age, and limit screen time to less than 2 hours a day. Also ensure that your child gets enough sleep. As part of a regular well-child checkup, your child's pediatrician will calculate his or her BMI and determine where it falls on the BMI for age growth chart. BMI is a numerical value based on the mass and height of a person. Your child's pediatrician will also evaluate family history of obesity, your child's regular eating habits, your child's regular activity level, and any other health concerns that you may have. Your pediatrician will also evaluate your child's psychosocial history for depression, sleep disturbances, and possible bullying. Treatment for childhood obesity includes feeding your child nutritious foods, adjusting their portion sizes to an age-appropriate level, increasing their physical activity, decreasing their screen time, and other age-appropriate behavioral approaches. Treating childhood obesity is not an easy task. You should provide ample support for your child. You can be a role model. Involve the whole family in this journey. Avoid talking about your child's weight. Discourage dieting and skipping meals. Praise your child's hard efforts and talk to your child about his or her feelings. Focus on positive goals and most of all, be patient. This is not a short or easy journey. Please take the time to review information from the resources provided. If you have any concerns about your child, please speak to your pediatrician. Please take this time to pause the presentation and test your knowledge of childhood obesity with the provided 10-question post-test. Thank you for viewing my presentation on childhood obesity. I hope you've enjoyed it. And more importantly, I hope that you have learned something about the prevention, treatment, and diagnosis of childhood obesity.